Well, as you mentioned, treating a pars stress fracture can be done in 3 phases. Can you go into more detail about those 3 phases?
Absolutely. So we've had a lot of success treating pars stress fractures in adolescents doing a 3-part progression, and that progression is over 3 months. The first phase is actually the first month, and each phase is a month. The second phase is month 2, third phase is month 3. In the first phase, from the time of detection, we want the individual to rest for about 4 weeks. And they'll have a normal progression of their everyday activities being painful. So after about 2 or 3 weeks, their pain will subside. If their pain is not subsiding with normal activities, they're doing too much. And so ultimately, no impact exercises. They don't want to do any cardio. The only cardio they can do actually is cycling. But we don't want to do any walking. They're going to stay away from anything that causes pain, try to limit any backpacks that they might be wearing, not participating in physical education class for this phase. But really, more or less, anything that's painful, they need to back off on. So this phase needs to be pain-free, and they need to be able to actually begin the next phase as pain-free as possible. The one thing that's a little bit tricky is pain medication during this phase. So individuals will oftentimes want to use anti-inflammatory medication, and I would just be wary of that because ultimately that can slow down bone growth and bone healing. They also might want to use Tylenol, and Tylenol will be help with pain. At the same time, if you mask the pain, then the individual might be doing more than they can or should to help with bone healing. So this first phase is really a matter of just being pain-free. The second phase is actually when they start doing specific physical therapy. Again, you want to minimize any significant amount of weight training that they're doing. They're still doing low impact exercises, but they can begin some core strengthening. They want to have a complete biomechanical evaluation of their spine, their hips, and their low extremity to make sure that their loading is appropriate and they're not loading their back too much. They want to stay away from anything that loads the spine, so no military presses, squats, or deadlifts. Ultimately, they can start some lower impact exercises. Again, core strengthening is going to be a part of this, flexibility, stretching, soft tissue work, and trying to normalize the spine and get them working towards being able to take on more stress. They can start doing some low impact cardiovascular, like elliptical, treadmill, walking, no running or jumping yet. And they want to avoid, still at this phase, any activities of bending backward or rotating activities. Pain is going to be your guide here. You still do not want to give them any exercises that are painful. And then as we move on from the second phase, and we move into the third phase, which is return to sport. And the return to sport is we're going to continue with our home exercise program and physical therapy, but now they're getting back on the field. And what we want to do over the course of 4 weeks is actually increase their sports participation by 25% every week. So the first week they're going back about 25%, second week 50%, third week is going to be 75%, and the fourth week they're going back to full participation. And ultimately each step of the way they should be relatively pain-free. If not, they need to stay at that phase until they can progress forward. When they've progressed back to full sport participation, it's recommended that they don't do any extra cardiovascular exercises, and they take a day, they alternate between what days are working out versus not. But you don't want to add on additional stress when you're getting back to sport. So you're going to hold off on additional cardiovascular training initially until your body has gradually accommodated to that.